So a lot of conversations we have in the office is a thing called arthritis. I know everybody has heard of it, but sometimes you don't understand exactly what that means when either you find it on x-ray reports or talking to medical doctors or even us. So I want to be a little more clarifying on what degenerative changes and arthritis means, okay? So why don't you come on in here a little bit. So a normal disc and joint looks like this. It looks nice and hydrated and plump at the disc area. The bones look nice and smooth around all of the edges, and all these nerves have great room to come out and do their job. Well, as we start getting older and we start putting wear and tear on the spine, and that can come from just normal wear and tear, injuries can speed up arthritis, but eventually the spine will start to deteriorate. So phase one, we start seeing a little more stress on the disc there. The disc space is getting a little thinner. It's starting to bulge out a little bit. It could come out here and touch onto that nerve, but not usually at this stage. The bone is fairly well and nice and smooth. It's a little more just soft tissue issues. Now we start going into phase two. This is where we're starting to see a little more bony changes. So if we look in here, the disc space is even looking a little less. We start having some extruded disc material. It's coming out here. You can press against that nerve, causing some of those radicular pain. But then we also see on x-ray findings a lot of this jagged edges of the arthritis. We can call that osteophytes. And then we can also see back here where that nerve comes out, the bones are getting thicker and having a smaller space for where that nerve comes out. Now that smaller space is called stenosis. You can hear that on some x-ray reports and MRI reports. And then finally we have phase three, where we have a lot of degenerative changes happening here, okay? Disc space is fairly non-existent. The bone is basically touching each other. A lot of osteophytes coming off the front. Space in that nerve coming out is much smaller. Again, stenosis causing restriction on that nerve, which can cause some of that pain down the leg as well. Now, when we get to each of the different levels, you will start seeing less and less mobility of the vertebrae. So if you look at this one, there's not much we can do. It doesn't want to move at all. When we go back to phase one, we still have some motion going on. And this is where we love to see our patients, is at normal or phase one degeneration, to maintain as much mobility as we get older and start having more degenerative changes. So things to know about arthritis is everybody's eventually going to have arthritis. Every spine that has been checked over the age of 70 has had arthritis. The amount you have really depends on how well you've taken care of your spine, how little injuries you've had, and how your life has been in general. So that's why we do what we do, is maintain healthy movement so that we can minimize the amount of degenerative changes you have. Some other words you just may know about with arthritis, and it can be known about many things like spondylosis means arthritis, osteophytes mean arthritis, degenerative disc disease, degenerative joint disease. All those are different terms for types of arthritis and that we work with. So arthritis is the number one thing we work with here in the office. The other thing about arthritis, it's also the number one cause of disability in America. So it's very important for us to take care of it and maintain as much mobility as possible.